So the date is July 12th, 2020. This is my first log entry. My client Jenny Harris is a 54-year-old woman, and she had just had her blood test done last week by Dr. Ross, in which he identified that she has high cholesterol. So she will be meeting with me today, and we'll be discussing what it is and what kind of steps we can take to better help her cause in addressing this issue. Come in. Hi, good afternoon. My name is Matthew Shoemake. I'm a health coach on staff at Dr. Ross. You must be Jenny.
Yes, Matthew, I am Jenny. Nice to see
Jenny,
you.
it's very nice to meet you. Please have a seat.
Thank you.
So, first things first, I have to ask, how are you feeling today?
I'm well. Can't complain too much.
Okay, well, I'm glad to hear that. Before I get started, have you ever heard of a health coach before prior to this meeting?
No, this is the first time.
Okay, well, no problem. So essentially what my job is to help you gain the knowledge that you need to better, give you confidence in taking care of yourself. Does that make any sense?
Yes, kind of like a sports coach or something like that.
Essentially, but more dealing with your health and lifestyle. But yeah,
Oh.
no, exactly. So Dr. Ross has informed me that you had visited him and had a blood test done in which he identified you had some high cholesterol.
Yeah.
Just to let you know, this is only a risk factor that he's identifying. It's not like he's diagnosing you with any kind of disease. He's just saying this is something you want to pay more attention to or it might cause problems down the road. So only a risk factor, not a disease. But has this been something that's been in your family before?
Yes, it is on both sides. My mother has high cholesterol. Several of her brothers and sisters have high cholesterol. And actually, my sister just told me that she has high cholesterol.
Okay. Well, I just want to let you know, you're in no kind of immediate danger. It's just something that if changes aren't made to your lifestyle now, they might cause, like I said, future complications down the road.
Good to know.
That is why, as me as a health coach, my job is to help you make those adjustable changes to prevent those chances of cardiovascular problems or anything of that nature that might stem from high cholesterol. Does that make sense?
Yes, it does.
Do you know what high cholesterol looks like in your body, or
No,
any kind of image?
I don't. You just hear these terms all the time, but I don't really know what it actually looks like.
Okay, well, let me pull up a video and give you more of a visual of what it actually looks like in your body.
In your artery wall form a fatty deposit called plaque. Over time, plaque can narrow the artery and reduce blood flow. LDL carries cholesterol into the plaque. This is why LDL is called the bad cholesterol. A common place this plaque can build up is in your coronary arteries, which are the blood vessels that feed your heart. This plaque buildup causes coronary artery disease and increases your risk of a heart attack. Plaque buildup in other arteries, such as the carotid arteries in your neck, can reduce blood flow to your brain and increase the risk of a stroke. Your liver also makes high-density lipoprotein, or HDL, also known as the good cholesterol.
Okay, so now that you've seen that video, do you have more of a visual of what that plaque looks like in your body?
I do.
So something that they mentioned in the video is HDL and LDL. Have you ever heard of those terms before?
I have, but I always get confused on which is the good one and which is the bad one.
Okay, so in essence, the high-density lipoprotein, which HDL, that's going to be your good cholesterol, and LDL is going to be considered your bad cholesterol. Now, both of them are needed within the body, but if you have too much of LDL, that's usually the reason why people are diagnosed with high cholesterol. But like I said, that's not a disease, it's just more of a risk factor.
I see.
But basically, so LDL, bad, HDL, good. Now, the problem is when plaque gets built up in your body, it restricts that blood flow, which in turn can cause oxygen deprivation.
Wow.
And oxygen deprivation can cause stroke and heart attacks. So that's a key thing that why we as health coaches try to help our patients understand the underlying issues on how to change those behaviors to prevent those kind of things from happening. Now, there's no magic pill to helping with high cholesterol. Mainly, it's going to be lifestyle changes such as watching your trans and saturated fats, exercising more, reducing stress. But we're not asking you as a client or patient to get rid of that as a whole, as far as not eating those kind of trans and saturated fats. We just want you to kind of modify and watch how much of it you have. Because in nutrition, it's more of moderation than it is elimination, is how I'd best like to say it.
Wow, that makes a lot more sense now. Thank you for clarifying that.
Yeah, no problem. Essentially, what my job is it's one thing for Dr. Ross to tell you what you have, but as a health coach, I want to help you understand what it looks like in your body and what changes you can make on your own time to prevent further complications. Because I'm here to give you advice, but I want to give you the confidence and knowledge you need to make these changes on your own. Have you ever heard of triglycerides in your body?
I have, but if you would ask me to define it, I couldn't do it.
So a lot of people think that triglycerides and cholesterol are the same thing. They're both super essential to our body, but the difference is triglycerides, they store unused calories and they provide your body with energy. And cholesterol, they're used to build cells and certain hormones. But a lot of people get this thing where they're the same thing, but the only way that they're the same is they're both lipids, which lipids are fats in your body. That's the only similarity that they have, but they have different functions. Let me show you some other sources from the American Red Cross and other places that might help you with your decision making on whether that's exercising more or eating healthier.
Great.
I meant to say the American Heart Association instead of the American Red Cross. Currently doing a CPR certification. Totally on me, but want to fix that mistake.
Oh, yeah. Totally understand.
So what they want, or what they try to stress, is these different lifestyle changes. And the most important one that they have on here is heart healthy eating. And basically, what they want to try to stress is limiting, as I told you before, the saturated and trans fats. Not saying eliminate them, but just watch what you're eating. And that's mostly found in your fast foods. Also, with weight management, they just try to stress. This kind of goes with your healthy eating, but also exercising. Just implementing, maybe it's a walk 30 minutes a day or something to kind of get your heart pumping to where you can kind of maintain that weight. Because what they say is the more you eat and the less you exercise, the more weight you gain. Well, vice versa. The more you exercise and less you eat, the more underweight you're going to be. So they want you to find that good balance between exercising well and also eating right. Another big thing is just managing your stress, and this goes for just taking some time to relax from your job, whether that's reading a book or watching TV, or it could be going on a walk. And also, they try to stress smoking has been linked to more high cholesterol cases.
Oh, wow.
So that's a big thing, and it's hard for people to quit cold turkey, but it's more of just reducing how much you smoke at first, but hopefully as an ultimate goal to stop smoking as a whole.
That's very interesting. I do appreciate you bringing out the information from the American Heart Association.
Yeah, well, it's one thing coming from me, but it's another thing coming from a big organization such as American Heart. But I definitely understand it's more comforting to know that the information is credible.
Definitely.
What I want to touch up with you as well is I know I've been talking about a lot of healthy eating and things of this nature, and you're probably still a little confused about well, what should I be eating? What's considered good? What's considered bad? And we all kind of know that fast food is bad for you. Everybody really knows that. But it's what are the key foods that I should be watching out for?
Yeah, that's great.
So what I want to talk to you about now is the foods that are considered bad cholesterol and good cholesterol.
Okay.
So we're going to play actually a little game with this.
Oh, wow. Okay.
If you like games.
I love games.
Okay. So what I have here, I have 2 metal cups.
Okay.
And I actually got some Legos we're going to use.
My boys used to love to play with Legos.
I still play with them to this day. So we're going to have, this is for bad cholesterol.
Okay.
So I'm going to put this right here. Have good here.
Okay.
Let's see if I can get these to stand up right. Okay, so I'm going to give you these pieces. I'm going to kind of push them your way.
All right.
And I'm going to read off some foods, and I want you to take a guess on what is good and what is bad.
Okay.
So, We're going to start off with butter. Do you think that's good cholesterol or bad cholesterol?
I want to say it's good, but I know it's probably bad.
We'd be 1 for 1 then. So what about oatmeal? Would you say that's
Um,
something that's going to be good for your cholesterol, or?
Well, they advertise it as good, so I'll go with good.
2 for 2. How about apples?
Oh, yeah. Good.
Okay, pizza.
Oh, I really want to put it in the good one. Really, really. But when it tastes so good, I guess it has to go to bad.
Yeah, it's going to have to go with bad on that one. Well, how about salmon?
Oh, yeah, that's good.
Okay. Almonds.
Trick question.
That's a tricky one.
I'll go with good.
Okay. Well, you would be right in that case then. And last but not least, we're going to go with biscuits.
Ooh, with or without butter?
We're going to go with.
Oh, then we'll go with bad.
Okay. See, you already knew how to identify them, even though you didn't know it was good versus bad. So, more credit to you. I mean, you already have the confidence that you need to change your healthy eating habits. So that's all that I have for you today. Do you have any questions you want to ask me?
So, just so that I'm clear, you're saying lifestyle changes like exercising more and eating healthier can reduce my cholesterol and risk of other health complications?
Yeah, I know. I mean, that's correct. So over the course of these next couple months, I want to help you with those changes, but it's ultimately going to be up to you because I'm not going to be able to see you 24/7. So I want to give you the knowledge now and the confidence to, on your own time, be able to pursue these kinds of changes.
I understand. Thank you so much.
You're welcome. So before our next meeting, I would like for you, to the best of your ability, to keep some kind of food journal, just so we can identify what you're eating. It doesn't have to be a perfect journal, but just something to give us an idea of like if we're heading in the right direction or not.
Okay.
Okay. So like I said, journal doesn't have to be perfect, but it will give me some kind of understanding on what the next steps should be.
I understand. That sounds good.
Okay. So let me find my business card for you. So here's my business card. Please feel free to reach out to me anytime.
Oh, thanks.
I really appreciate your time coming here. I know it's a chaotic time and people are very busy, but I appreciate you coming out and talking to me.
You're welcome. Thanks.
You're welcome. So I hope you have a great day, and I'll see you next time.
Thank you so much.
Yes, ma'am. You're welcome. So I just finished up with Jenny. All things went well. It seems like she has a good understanding of things she didn't know about prior to coming here. We left it off that she'll be keeping a food journal of things that she's eating. I told her to identify just the big things, nothing too perfect about those saturated and trans fats that we had talked about, and just the amount of vegetables and fruits she's getting in. That way, the next time that we meet, we can discuss better steps to helping her cause and identify those underlying issues that we may have not noticed in the first place.